If you have sciatica leg pain that keeps coming back, you may be making a few mistakes without even realizing it. After 29 years in practice and helping thousands of patients, I see the same patterns over and over. People are doing what they think is helpful, like stretching certain muscles and relying on common home remedies, but these choices can quietly slow healing and cause the leg pain to return. In this video, I'm going to walk you through the 5 most common mistakes that keep sciatica from fully resolving. And more importantly, I will show you exactly what to do instead for each one so you can finally give your sciatica a real chance to heal. Make sure you stay until the end because mistake number 5 is one of the most common and you likely do it every day without even realizing it. Hi, I'm Dr. Cordova, a chiropractor in Houston, Texas, with 29 years of experience helping people with chronic neck pain, back pain, poor posture, and sciatic nerve irritation. As a chiropractor, I believe the adjustment is the most powerful thing we do, and being specific with it matters, which is why I rely on spinal x-rays to guide every patient's care. On this channel, you'll get simple, specific, and safe strategies you can use at home to feel better fast. I share the same x-ray guided chiropractic strategies, posture fixes, and modern therapy insights I use in my clinic to help patients get long-lasting relief. Subscribe to learn how to take care of your spine, prevent flare-ups, and stay pain-free with clear, actionable steps you can use right away. Sciatica can be frustrating because it often feels like it gets better, then months later it comes right back. In most cases, that is not because the nerve cannot heal, but because a few common choices keep irritating it. Once those mistakes are corrected, the body finally has a chance to calm things down and heal properly. We're going to break down these mistakes and show you how to fix each one so you can finally give your sciatica a real chance to heal. Starting with mistake number 1. Mistake number 1, stretching the hamstrings. This is a mistake because in most cases, hamstring tightness is not the cause of sciatica. Sciatic pain is usually coming from the nerve compression, either from the piriformis muscle in the hip or from compression of the L4, L5, or S1 nerve root, often related to a disc herniation. When you stretch the hamstrings, you place additional tension on the sciatic nerve itself. That added tension can irritate an already sensitive nerve and make symptoms linger or flare up, even though the stretch feels logical. Here's what you should do instead. If your sciatica is coming from the piriformis muscle, a targeted piriformis stretch can be helpful because it addresses the source of compression rather than pulling on the nerve. Another option is a sciatic nerve glide, which gently moves the nerve along its entire path from its origin in the spine down through the hip and into the leg. This can help reduce irritation without aggressively stretching the nerve. Once you stop pulling on the nerve with a hamstring stretch and start addressing the real source of irritation, sciatica finally has a chance to calm down and heal. Mistake number 2, using heat. This is a mistake because heat increases blood flow and inflammation in an area that is already irritated. When sciatica is caused by nerve compression, adding heat can increase swelling around the nerve, which may feel soothing at first, but can actually prolong irritation and delay healing. Here's what you should do instead. Use ice for about 10 minutes at a time, either once or twice a day or when symptoms flare up, making sure there is at least an hour between the sessions. Ice helps calm inflammation and reduce irritation around the nerve, which is why many people notice relief fairly quickly when they make this switch. As inflammation settles and pressure starts to come off the nerve, symptoms are much less likely to keep coming back. Mistake number 3, not creating space around the injured nerves. This is a common mistake because sciatica is often driven by compression on the nerve, commonly due to a disc herniation placing pressure on the spinal nerve roots in the lower back, specifically L4, L5, and S1, which feed into the sciatic nerve. If this has never been explained to you, it is not your fault. Without creating space, that pressure never truly comes off. Many people try to address this at home by hanging upside down on an inversion table or doing stretches that increase tension, but these approaches pull on the spine rather than decompress in a controlled way. Others spend time on core exercises like planks given by their therapist or passive treatment like electric stimulation. Both of these can be helpful for comfort, but they do not reduce compression on the herniated disc or the affected nerve roots. In many cases, people are simply not getting the right treatment at the right time. Here's what you should do instead. The treatment focus should be on reducing compression on the herniated disc and the involved nerve roots so the nerve can settle down and heal. One method we use in our office is non-surgical spinal decompression, which is designed to gently and repeatedly reduce pressure at the affected spinal levels. By creating space where the nerve roots exit the spine, decompression can reduce irritation and support the healing process. Hundreds of patients in our office have experienced leg pain relief without surgery. and we were able to prevent their sciatica symptoms from coming back once proper non-surgical spinal decompression was introduced at the right stage of care. Mistake number 4, not addressing the main cause of the pain. This is a mistake because the real issue is often spinal misalignment, including pelvic or sacral misalignments that go undetected and uncorrected. Over time, these spinal and pelvic distortions place abnormal stress on the discs. That stress can lead to disc bulges or disc herniations, which irritate the spinal nerves and cause symptoms that travel down the leg. Again, if no doctor ever explained this to you, it's not your fault. You are learning differently with this video. Here is what you can do. The spine needs to be properly evaluated by a chiropractor to identify where the alignment of the spine is off. This is why we check our patient's spine with a thorough evaluation that includes posture assessment, observation, and specific tests, then use x-rays to evaluate and measure the spinal misalignment. The chiropractic spinal corrections that follow are based on those findings. There is no guesswork. The benefit of dressing the spine this way is long-term stabilization, improved spinal mechanics, and prevention of recurring sciatica-related leg pain. We have seen great results with our patients relieving their sciatic leg pain by combining chiropractic adjustments of the spine with non-surgical spinal decompression. Mistake number 5, staying in the same sitting position for too long. This is a mistake because prolonged sitting increases pressure on the discs in the lower back and places constant stress on the L4, L5, and S1 nerve roots that feed into the sciatic nerve. This becomes even worse when sitting in a slouched or poor posture, which further increases disc pressure and places the spine in a flexed position for long periods of time. Over time, this added stress can continue to irritate the nerve and make sciatica more likely to return. Here's what you should do instead. Change positions frequently and avoid prolonged sitting whenever possible. Using a sit-stand desk allows you to alternate between sitting and standing throughout the day, which reduces sustained pressure on the discs and nerve roots and gives the spine a chance to recover. By reducing continuous loading on the spine and improving posture throughout the day, many patients notice less leg pain and fewer flare-ups over time. You can take control of your sciatica by avoiding these 5 common and often unknown mistakes. And if you want to take one step further toward more permanent relief from sciatica leg pain, consider getting a spinal checkup from a chiropractor who takes x-rays and also combines care with non-surgical spinal decompression. If you got value from this video, like and share it so others dealing with sciatica can avoid these same mistakes. And tell me in the comments which of these 5 mistakes you have been doing without realizing it. I would like to know. Remember to subscribe if you want to learn how to take better care of your spine, prevent flare-ups, and stay pain-free with clear, actionable steps you can use right away. And in the next video you should watch is this one, where I give you 5 easy moves to relieve a sciatica leg pain fast. Go watch that video next.